Hello everyone, my name is Liu Ruoshi. I'm from the Department of Traditional Chinese Medicine, the first affiliated hospital of China Medical University. I'm the teacher of this class. Today, I'm going to explain the small intestine meridian of hand, 太阳, in the 12 meridians. This class will explain the related contents of the small intestine meridian of hand, 太阳, from the 3 aspects. Now, let's start our class. First of all, let's start to learn the cause of the meridian. The small intestine meridian starts from the ulnar side of the tip of the little finger, following the ulnar side of the dorsum of hand. It reaches the wrist. Then it goes out from the styloid process of the ulnar, ascends along the posterior border of the lateral aspect of the forearm, passes between the olecum of the ulnar and the medial epicondyle of the humerus, and runs along the posterior border of the lateral aspect of the upper arm to the shoulder joint. Calling around the scapular range, it means the superior aspect of the shoulder, and turns downward to the supraocular fora. It connects with the heart. From there, it descends along the esophagus, passes through the diaphragm, reaches stomach, and enters the small intestine, its pertaining organ. The branch from the supraclavicular fossa ascends along the neck to the cheek, reaches the outer cancers, and enters the ear. The branch from the cheek runs upward to the inferior breech range, and further to the lateral side of the nose. Then it reaches the inner cancers. The course of the meridian has been learned. Next, we start to learn the principal indications of the small intestine meridian of hand, 太阳. It can cure the diseases of hand, nape, ear, eye, and throat, febrile and mental diseases, and the diseases of the regions along the course of this meridian. The first 2 aspects of the small intestine meridian of hand, 太阳, have been studied. Now, let's start to learn the third aspect, the points of small intestine meridian. This meridian appears at 少泽 and goes to 天宫. Bilaterally, it's consisting of 19 acupuncture points. In this knowledge point, we are going to learn 6 acupoints commonly used. The first point is 少泽. The acupoint is located on the ulnar side of the distal phalanx of the little finger, 0.1 寸, descendants from the corner of the nail. The location of this acupoint contains arterial and venous network, branch of the ulnar nerve. The acupoint can cure acute mastitis, insufficient lactation, loss of consciousness, febrile diseases, headache, conjunctivitis, sore throat. The operation method of this acupoint is that subcutaneous insertion 0.1 寸 or prick to cause bleeding. This point should be used carefully in pregnancy. The second point is 后溪. The acupoint is located when a loose fist is made on the ulnar aspect of the palm, proximal to the fifth metacarpal phalange in joint, at the end of transverse crease of the palm, at the junction of the red and the white skin. The location of this acupoint contains dorsal digital artery and vein, dorsal break of the ulnar nerve. The acupoint can cure pain and rigidity of head and neck, pain in the lumbar and the back, spasm and pain in fingers, elbow and arm. Deafness, eye congestion, manic psychosis, malaria. The operation of method of this acupoint is that perpendicular insertion 0.5 to 1 寸. The third point is 养老. The acupoint is located on the dorsal ulnar aspect of the forearm, in the depression on the radial side of the styloid process of the ulnar. The location of this acupoint contains venous network of the wrist, dorsal branch of the ulnar nerve. The acupoint can cure blurring of the vision, pain of the shoulder, back, elbow, and arm. The operation method of this acupoint is that oblique insertion towards the elbow 0.5 to 0.8 寸. The fourth point is 小海. The acupoint is located when elbow is flexed in the depression between the olecranon of the ulnar and the medial epicondyle of the humerus. The location of this acupoint contains superior and inferior ulnar, collateral arteries and veins, ulnar nerve. The acupoint can cure pain and numbness of elbow and arm. Epilepsy. The operation method of this acupoint is that perpendicular insertion 0.3 to 0.5 寸. The fifth point is 天中. The acupoint is located in the depress in the center of subscapular fossa, level with the fourth thoracic vertebral. The location of this acupoint contains muscular branch of the circumflex scapular artery and vein. Distribution of the suprascapular nerve. The acupoint can cure pain in the shoulder and the scapular veins, injury in shoulder and back, eczema. The operation measured of this acupoint is that perpendicular or oblique insertion 0.5 to 1 寸. The sixth point is 听宫. The acupoint is located anterior to the tragus and posterior to the condyloid process of the mandible in the depression formed when mouth is open. The location of this acupoint contains a auricular branch of the superficial temporal artery and the vein. Distribution of the branch of the facial nerve, auricular temporal nerve. The acupoint can cure the tinnitus, deafness, arterial, toothache, trismus. The operation measured of this acupoint is that perpendicular insertion 1 to 1.5 寸 with the mouth open. Now, the content of the small intestine meridian of hand 太阳 is finished. Thank you for watching.